Now, we know that more families are struggling to provide food for their families during the coronavirus pandemic, but we want to dig into some of the details for you. According to census data, the number of Americans who say they cannot afford enough food for themselves or their children is growing. Experts say it will get worse now that some government benefits have expired. The data shows, as of last month, about 12% of adults lived in households that didn't have enough to eat at some point in the previous week. That's up from roughly 10% in early May. Almost 20% of Americans with kids at home couldn't afford to give their children enough food. For more on this, I want to bring in Mariana Chilton. She's a health management and policy professor at Drexel University, where she's also the director of the Center for Hunger-Free Communities. Thanks for joining us today to talk about such an important issue. I'm wondering if you can just explain how the pandemic has contributed to the growing number of Americans who cannot afford enough food and who's most at risk here.
Thank you so much for having me. Well, what's happening right now is not just the pandemic that's causing an increase in food insecurity, it's also the lack of response by the United States government to help protect families during this time when families need to be sheltering in place. Many businesses have closed, children are out of school. So it's extremely important that the U.S. government respond in ways that help to buffer families through this very difficult time. And this major increase really indicates a major public health crisis that goes far beyond what COVID-19 is doing to us and doing to people around the world. Food insecurity has been a lingering public health crisis that has been unaddressed or underaddressed for decades in this country. Now we can actually see the major fault lines in our society that has allowed food insecurity to flourish and to increase. This causes major public health problems in terms of children's education, their health and well-being. Children for decades, if not multiple generations.
And your audio dropped out there for a moment for me, but I did catch the gist of what you're saying, and it is sobering. Every projection right now is that the economic fallout created by this virus will get worse. So how will that exacerbate what's already a challenging issue for so many?
So the increase in food insecurity is going to especially affect young children, because we know through our research that food insecurity affects children's cognitive, social, and emotional development, so that by the time they even get to kindergarten, they'll be behind their peers. So food insecurity is going to affect people's cognitive health, their physical health, and this is something that children will bring to them through adulthood. They won't do as well in school. They won't be able to get a good enough job in order to pay their wages. So the impact, the public health impact of food insecurity will be actually quite severe. It already is severe, and it's only going to get worse if the U.S. government doesn't respond quickly.
Now, we've done stories on farmers doing what they can to give free food to people, their own crops, and there are many organizations trying to do outreach. But give us some of your tried and tested tips as far as identifying, ethical local food banks or any other means you think we can all take to help people.
Yeah, I think everybody has some action that they can take. Join into a mutual aid society. Find ways to contribute to making sure that people have enough food, but also making sure that they have enough money to pay their rent and pay their utilities. The bigger issues, however, really lie with Congress. The United States Senate didn't pass the stimulus package, the HEROES Act, and left a really important piece of legislation to linger, and that will increase food insecurity. They had an opportunity to increase SNAP benefits by 15%, and SNAP is formerly known as food stamps, and we know it's the most effective way to address food insecurity in the immediate moment. But I really think we need to think about longer-term solutions. We are in a massive crisis right now, not just with COVID, but also with our government, with racial uprising and continuing racism in this country. So we really need to take more revolutionary approaches. That is, we need to look into reparations and make sure that we're investing into Black and brown communities in terms of housing, education, and healthcare, and making sure that indigenous communities and nations are having their treaty rights respected, because we know that Black, brown, indigenous people, and immigrants are suffering the highest rates of food insecurity. We need to take action right now in terms of individually we can reach out, but we also need to make sure that our government is responding in the way that it ought to.
You know, I've heard some people say that the only real silver lining from seeing so much suffering and unease out there is that maybe it will give us all an opportunity to address these issues in a different way. I do want to ask you about this concept that we know is taking place, people skipping meals so they can pay rent, skipping other bills so they can eat, or skipping, eating so they can pay bills. Senator Martha McSally urged her supporters to fast a meal so they could donate to her campaign. Now, later she said the suggestion was a joke, but when it comes to politics, people really listen and believe these things from their elected leaders. I'm just wondering what you make of a statement like that from an elected official.
Well, it demonstrates really how out of touch members of Congress really are with what's going on with the American people. I think especially in the United States Senate, it shows you how out of touch that the senator can be, that in her own state, 1/4 of the people have reported food insecurity during the pandemic. When people skip a meal, it affects their cognitive health, it affects their physical health and their mental health. So it just shows how really out of touch she is, and the United States Senate is, and the fact that they actually left Congress this summer and didn't pass a stimulus package is deeply upsetting. It also makes us lose trust in our elected officials and lose trust in our supposed democratic processes. This is why we really need to think about more transformative approaches, such as guaranteed income, and making sure that families have an opportunity to have better wages. And if they can't have wages, to make sure that they have income to pay for food, utilities, and rent. We can't have this kind of thing where people are having to make a choice between heating their homes or cooling their homes and eating. It's a major public health crisis that needs far more attention.
Yeah, I think certainly people are looking at issues that you've just suggested differently now than they would have a year ago. So we will see what comes of all of this. Really great to speak to you. Professor Mariana Chilton, thanks so much for your time today.
Thank you for having me.